New patient availability, part 2 of 2.
Not only done well through this economic debacle, but has thrived.
We have this number that will be there unless there's an X factor, okay? And the X factor in this case is a new dentist moving into town. It's their family, it's their relatives, never gone to the dentist, they're going. So the availability are the patients that are going to go to the dentist, that are going to call a dentist tomorrow, whether you do anything or not, whether there's an X factor or not. That is that 1,000 patients. They're going to call someone. You get called because you're in a collection device. You're at a website, you're doing some marketing online, you're in a Yellow Pages magazine. They're going to try to track a dentist, they're going to Google it, and they're going to find a dentist to work with. It might be you, it might be somebody else. So technically, there's no X factor. It is that 1,000 patients a month that's going to do something. They're going to spread out to this group. To understand the process somewhat, there are 250 dentists and there are 1,000 patients. So each month, each dentist will get 4 patients on average, right? Well, when a dentist moves into the area, maybe they get 10 more patients, so we're at 1,010. So they get those extra patients. They maybe also collect more of your patients. So instead of your average of 4 patients a month, you're getting 3.8 because it's a new dentist, it's a new office, it's more convenient. So now the X factor changes somewhat because of what the other new dentist might do. But if new dentist isn't in the market, isn't doing things to communicate differently than anyone else, they're just draining from you with a small rise in the X factor of availability. And so now the patient base drains. And where this affects you more specifically, and where everybody is going to, is online. Not every dentist is online in a decent way, let alone a major way. Once again, there's some X factor occurring, but it doesn't necessarily rise to the occasion of filling in that gap of that new dentist. You moving to those places is a good basis, but it's like being out in the rain. Open your arms wider, you catch more rain, but then less rain falls on other things and other people. And you can drain it and you can funnel it into you and do more of that. You can be the only person on Facebook for a month or a year, but you don't make the 1,000 bigger. So if somebody comes on board, they take them away. So then you're back to where you were. Then you got to find the next Facebook, and then you keep doing that. You never increase the 1,000. Availability goes to the root of the 1,000. The statistics show that generally there are more patients out there that need dental care and can pay for it. I mean, these are higher income people that don't get it and might never get it, or they'll put it off so long that you won't be involved in it or it won't help you in this moment. And you want to increase that 1,000 for yourself specifically. What if you went out and not only became the person that collected more patients, but you also want to go out and create? The X factor lives up to 1,050 patients, and you are the one that has made that occur. Those 50 patients, the highest likelihood of those going to you. That is availability. The marketing, services, and products that Niche Dental offers gets to the reality of this availability and says, let's make the availability a much more significant element than just gathering up more patients. I call it connective communication. And what that does, it talks about the creators, the gatherers, and the improvers. You need to look at all three of those. For the most part, gathering is the internet. And I consider the internet a lot like fluoride. We live out in the country. Our kids would have to take those pills when they were younger because they didn't have the water with fluoride in it. And so they were able to cure their teeth in a number of ways by just taking a pill. That's it. The internet is like that. You take a lot more fluoride. There's a point where it stops, quote unquote, helping, and then starts getting your teeth brown. You can't use gathering as the only part of your process to develop patients. We want to increase availability. That is what you do, all three of those things. Bring it together. Connective communication deals with that aspect of marketing. You can buy stuff less price and less cost, but in the end, you have to create the X factor. And you can't just follow. You can't just gather, right? You can't follow the others and gather with them. You have to get out there and create. You have to create new patients by increasing availability. And you do that by more than the products. You do it by adding the products together in a semblance of order. It's your fluoride, it's your brushing, it's your flossing, it's your restorative work when you need it, it's the sealants, it's all of those things. And imagine me asking you, the dentist, if I could just do 1 or 2 of those things, which would you let me do? Yes, if that's all they're going to do, these would be the best. But if they don't get the root planing or, the other periodontal work, it doesn't matter sometimes all the other stuff they do because they don't have the capability. Their genetics doesn't do it. It's the same with your practice. Your practice could do all the things the others are doing, but it might not help unless you create the X factor. The X factor is just a simple way to say we're changing the environment. Direct mail will be better. The other marketing, newspaper, outdoor, whatever, is going to be better. Your website is going to be better. Yellow pages, whatever you're doing, because you create an X factor, adding the three things, not just the one or two. You do all of these things together, and that's where you take your practice. If you've been looking, this is where you should come, to Niche Dental for consulting. Ali Gonzalez works with me on the direct mail, and we have a specific reason for doing the way we do it. People want to bring in different type of pricing schemes, price points that they want to see. But to me, it's the system. It's like your practice. You could charge less, but then what do you get after the fact? What kind of practice do you have? You can do these things differently, but if you don't do them in a way that's strategic and structured, you're not going to have this result that multiplies over top of the others.
And I have gone up maybe 5 to 10% every year since 2008.
My name is Dick Schwalik. I'm a consultant and coach for Niche Dental and the owner. Call Ollie. He's at expressdentalmarketing.com, expressdm for short.com, or nichedental.com. Talk to Ollie, get a hold of Ollie. He'll set up a meeting. It is for you and your patients, and it's for the community. It's not about marketing or gimmicks. Creating an environment where people decide to do more, and more people decide to do something. Thank you.
We're even ahead by about 10% this year. So it's been a continual growth curve. You can't complain about that.
You have been watching New Patient Availability, Part 2 of 2.